Welcome to GI Insights on ReachMD. I'm Dr. Charles Turck, and today I'll be discussing wearable point-of-care testing in inflammatory bowel disease, or IBD, with Dr. Shalini Prasad and Sriram Muthukumar. Dr. Prasad is the co-founder of EnLiSense, as well as the head of the Department of Bioengineering at the University of Texas at Dallas, and she presented on this topic at the 2025 Crohn's and Colitis Congress. Dr. Prasad, it's a pleasure to have you with us.
Likewise, Dr. Turck.
And also joining us is Dr. Muthukumar, who's the CEO and a co-founder of EnLiSense. Dr. Muthukumar, thanks for being here.
Thank you, Dr. Turck.
And so starting with you, Dr. Prasad, what was your objective in developing a wearable device for IBD patients?
IBD, as we all understand, is a disease of flares and remission. In a disease that goes up and down, it is absolutely important to have a technology or a tool that allows us to monitor disease activity in a real-time and continuous manner. Currently, the only ways of doing this are through stool testing or through serum testing or imaging. So in between these points, the patient, especially when they seem to believe they have symptoms, they want to know if it's a false alarm or is it real. The clinician, on the other hand, does want to know how the patient is doing. And the biochemistry, primarily C-reactive protein and calprotectin, are the two major clinical cues that help the physician to make assessments of how the patient is doing. So wearables, especially perspiration wearables, which is what EnLiSense has developed in collaboration with my lab at UT Dallas, allows you to track in real time these inflammatory markers and report the actual expression profiles, that is the quantification, and eventually allow for thresholding of patient activity based on these measures.
And would you explain a little bit more about how this device detects IBD flare-ups?
Absolutely. This is a three-part device. There is a sensor, a little sensor strip that sits on the skin, and it is then connected with a small reader. This reader then talks to the cloud. So as we're wearing this, all of us today in this room are sweating, and we're sweating at a very small rate. It's 1 nanoliter per gland per minute. So this IBD aware device, the sensor piece of it, essentially pulls in that perspiration that is there and looks for key inflammatory biomarkers. It can look for 4 biomarkers at any point of time. And currently, we're looking at C-reactive protein calprotectin and additionally IL-6 and TNF-alpha, primarily from the perspective of what therapy looks like today for patients. Now, what happens is that every 3 minutes, a measurement is taken, which essentially looks for the expression concentration of these biomarkers, converts the actual measure or transduces it into a reportable concentration. So this measurement is then made through the reader, which is then sent out to the cloud, where all the algorithms reside, where it's converted back into the concentration and a real-time trending profile of the expression profile of these biomarkers show up on your app, whether it's through your phone or in some form of an electronic interface. So this is the ecosystem of IBD Aware, and this allows you to track patients primarily 4 days at a time before you replace that sensor strip. And you continue to do this similar to what you do with continuous glucose monitors for blood glucose.
For those just tuning in, you're listening to GI Insights on ReachMD. I'm Dr. Charles Turck, and I'm speaking to Dr. Shalini Prasad and Sriram Muthukumar about the development of a wearable device capable of detecting IBD flare-ups, which was showcased at the 2025 Crohn's and Colitis Congress. So, turning to you now, Dr. Muthukumar, let's discuss how we can incorporate this device into clinical practice. How do you envision it impacting the daily lives of patients with IBD?
The subject will be prescribed the wearable device by the clinician based on their disease severity. The markers that Dr. Shalini Prasad referred to are the markers for IBD. Today, the clinical cutoffs for the IBD disease severity is based on the serum CRP threshold of greater than 5 milligram per liter, and a fecal calprotectin cutoff can range depending on whether it's ulcerative colitis or Crohn's disease, anywhere from greater than 50 UG/G to all the way up to 150. So we are going to be using these thresholds to optimize our thresholding in sweat. So a clinician would be looking at the sweat CRP and the sweat calprotectin levels to decide how the patient's disease is trending And this is done in real time through a remote patient monitoring using both an app-based interface and a web portal. And using that information, the clinician and the patient can then decide on the next course of action, which could be imaging or follow-on lab blood tests. What this helps with the current standard of care is that today the serum CRP levels and the fecal calprotectin are done asynchronously, and there is no clear insights or limited insights into the disease severity or when the flare is going to happen. With this device, being a real-time monitoring, looking at the sweat calprotectin and the sweat CRP, the clinician and the patient can actually monitor their levels, and when it's going up above the cutoff, they can then take the necessary action. And that is how we plan to make it a patient-centered clinical decision support system.
Do you think this device has the potential to replace any ways in which we use current methods like endoscopy or blood tests?
Absolutely. Because today, these endoscopy tests or blood tests are done regularly. The patient is scheduled to come in every 3 months or every so often, and these can add a significant cost burden to the subject. And not having an insight into when the flare is going to come. So most of these testing are done post-symptomatic, which means the patient has already relapsed and is on a painful recovery path, which can last anywhere from a few weeks to a couple of months. This device complements the current standard of testing, wherein you're now getting an active levels of your sweat CRP and your sweat calprotectin. And that way you can actually anticipate when the flare is going to come. So there is a level of pre-symptomatic alert that can then give the patient and the clinician time to do a timely intervention, minimize the likelihood of relapse, and avoid expensive endoscopy and blood testing.
Well, as we approach the end of our program, I wanted to ask you both, what are your hopes for the future of non-invasive monitoring technology? Dr. Muthukumar, let's start with you.
Today, what we see is that reliance on blood-based glucose testing has significantly gone down, and people use continuous glucose monitors, and even that is used as a feedback loop to do as insulin delivery to the diabetic. Similarly, we envision with this IBD wearable being able to track inflammation in real time and actively monitor. And over time, we expect such non-invasive technology to replace expensive or invasive blood testing, imaging, and be the standard of testing for inflammation levels. So today, none exist, but in a decade or so, this is going to be the game changer.
We think that IBD care can be transformed with this IBD Aware platform. The reason is that, as Sri indicated, the idea of having the opportunity to know what the disease activity looks like at any given point of time is a tool that can help actionable information to be used in clinical practice and in the way the patient is enabled towards looking and actively managing the disease. IBD is an expensive disease because it requires essentially long-term chronic monitoring. If there is a tool that can essentially close this loop, provide that closed loop feedback so that the time to a particular clinical intervention can be modulated or the peak of the flare can be reduced. If these two things can be done, or broadly, the path towards biochemical remission can be identified, then truly that is the game changer that every IBD patient is seeking. Through Crohn's and Colitis Foundation, who are our evangelists for essentially putting us on this road towards looking at novel technologies. And this is an outcome of those initiatives towards building out capabilities that are truly non-invasive and are very patient-focused and in the care delivery that they may offer to the patients. So with that vision in mind, what we started on this path 6.5 years ago, today we can show you impact with this IBD Aware platform. We have run multiple clinical studies with our collaborators at Mount Sinai and University of Chicago. And we've shown that, yes, we can measure calprotectin in sweat, which correlates to what you see in stool. Yes, we can threshold serum CRP along with that, with what you see in sweat. So sweat thresholding maps to the serum thresholding. These are the first two critical steps towards truly enabling this platform technology to have patient impact.
That's a wonderful look ahead as we come to the end of today's program, and I want to thank my guests, Drs. Shalini Prasad and Sriram Muthukumar, for joining me to discuss exciting new wearable technology for patients impacted by inflammatory bowel disease. Dr. Prasad, Dr. Muthukumar, it was great having you both on the program.
Thank you, Dr. Turck. It was a pleasure being on this program.
Thank you, Dr. Turck. It was a pleasure for me too.
For ReachMD, I'm Dr. Charles Turck. To access this and other episodes in our series, visit GI Insights on ReachMD.com, where you can be part of the knowledge. Thanks for listening.